So PRAGUE-12 trial was a randomized prospective trial assessing the effect of concomitant surgical ablation in patients who are indicated for cardiac surgery for other reasons, due to coronary artery disease or valve disease, and have a history of atrial fibrillation. And these patients, 234 patients, have been randomized to either cardiac surgery alone or cardiac surgery plus concomitant surgical ablation. And we are now reporting the long-term results. The primary endpoint was a composite of cardiovascular death, stroke, bleeding, and hospitalization for worsening of heart failure. To fully explain the results, I have to start with basic characteristics. Both groups were well balanced with one exception. It was a history of myocardial infarction that was more often in control group in the non-ablated patients, and it affected the interpretation of the results. And regarding the results, the incidence as primary endpoint was higher in the control group than a surgical ablated group with p-value 0.02. So it documents the efficacy of the surgical ablation. After adjustment of all variables, including coronary artery disease and history of myocardial infarction, the difference was not more significant with p-value 0.06, so it was really close to the statistical significance. Regarding the secondary endpoints, the incidence of stroke was reduced in the ablated patients, and this difference remains significant even after adjustment of all covariables. And if you look at the curves showing the incidence of endpoints over time, then the curve started to diverge 1.5 years after the surgery. It means that additional long-term follow-up is needed to show the effect of the ablation. So far, the older studies have shown that surgical ablation of atrial fibrillation is safe and is associated with a higher chance for sinus rhythm, but without any clinical improvement, because the follow-ups of older studies were short up to 1 year. The new evidence is that surgical ablation is associated with improved outcome and reduced number of strokes. The efficacy of surgical ablation is low in terms of completeness of lesions after surgical ablation. So very often endocardial catheter touch-up is needed to complete the surgically performed lesions.